Hello and welcome to the Indian Sun. I'm Indira Laisram. My guest today is Dr. Prerna Varma, a research fellow at the Turner Institute for Brain and Mental Health, Monash University. As a researcher, Prerna is passionate about how we sleep and how it impacts all aspects of our health, including during the current pandemic. Her current research explores ways to support a community's sleep, health, and well-being. Welcome, Prerna. I'm going to start with a question on the research that you did at the start of the pandemic in 2020. And I know it focuses on 60 countries. Can you tell us what some of those findings are and the key issues that you focused on?
Yeah, thank you, Indra, for having me. Really, really glad to be here. With the research that we did at the start of 2020, we were really interested in exploring how the pandemic and the associated lockdowns affected us in the sense like what were its impact on our mental health, how our sleep behaviors changed, how our lifestyles changed during the pandemic. So what we did as a part of, I was doing PhD back then, and we decided to sort of take this topic and build a survey, which we pretty much disseminated to anyone who wanted to participate. So we weren't really trying to restrict it to a country, and ended up getting participants from 60 plus countries where people responded about their mental health, how they were coping with the lockdowns, what changes have happened in their routines, how their sleep had changed, and so on. One of the key things that we found in this survey was that people had elevated levels of depression and anxiety at the start of the pandemic. And one of the key areas that came out to us was that younger people were reporting more elevated concerns for their mental health in the sense that they reported higher rates of depression and anxiety, which was quite linked to their financial distress. So these were the people who were largely involved in essential roles, or they were involved in jobs that didn't have enough job security. So there were quite a lot of factors: the social isolation, financial distress, as well as sleep, and the changes in their sleep that they saw, which was impacting their mental health. So that was quite interesting to us with the survey. And as we sort of went on, so we kept on surveying these people across for a year. We found that while depression and anxiety sort of improved over time, so we got used to the pandemic, we got used to the lifestyles a little bit, there were still people who were reporting quite extensive changes in their sleep, especially more sleep disturbances, having bizarre or weird dreams, and nightmares. And that in itself was linked to their mental health. So people who reported poor sleep were at least 2 or 3 times more likely to have depression, to experience depression and anxiety, rather than those who slept well.
So that means, So that means this is a familiar and a universal pattern, isn't it? Sleep. So now throw some more light on it, because I find it really interesting how sleep is so interconnected to mental health.
I find it's a passion of mine talking about sleep and getting the sleep message across. So, but yeah, it's so interesting that we say sleep is one of the 3 pillars of health. So you've got diet, you've got exercise, and you've got sleep. Mm-hmm. And more often than not, we focus so much on exercise and diet. So we have to go to the gym, we need to exercise well, we need to take care of our diet. And somehow sleep sort of falls into this thing where we don't pay as much attention to it, even though we spend a third of our lives sleeping. But the fact is that sleep is one of those factors that's related to every aspect of your physical and mental health. To date, we haven't found any mental health condition, whether it's depression, anxiety, bipolar disorder, any personality disorder, or any sort of mental health condition that is not linked to sleep. So sleep is this really important factor that you need to think about and care about. So you need to care about how you're sleeping, what your quality of sleep is, how you feel upon waking up, because it goes beyond just the night sleep. Yeah.
I'm just very curious about this because I keep reading a lot about sleep apnea. Is sleep apnea also a term and an experience that is linked to all this?
Yes. So sleep apnea is one of the most common sleep disorders. It's usually age related in the sense that people who are slightly older tend to experience it more often, but doesn't mean you can't get it.
Mm.
at a younger age. And what it basically involves is a cessation of your airflow. So while you're sleeping, you essentially stop breathing. And then so the snoring that you hear, like some people snore when they're sleeping, that's essentially related to their airways being blocked, and them not receiving enough airflow. So you wake up too often during the night. And sleep apnea, as I said, is one of the most common physical sleep disorders. And it's related, we have found that it's related to quite a few things. So it's related to mental health. People who experience sleep apnea are more likely to experience depression and anxiety as well. They're also quite likely to experience insomnia. So they wake up feeling unrefreshed. You might have 8 hours of sleep, but you wake up feeling like, oh, I'm still very tired. I don't feel as fit. But it's also related to quite a few medical conditions like high blood pressure, cardiovascular diseases, as well as dementia. So there's quite a lot of research studies that are coming up now, which show that there's a significant link between having obstructive sleep apnea and experiencing Alzheimer's or dementia later in life.
Mm. So as to some of the solutions when it comes to regulating sleep and sort of bring that under control, do they have sleep clinics and stuff like that?
We do. Yeah, so it's very interesting in the sense that there are different resources for sleep that you can go to. One of the biggest resource that I've found is an organization called Sleep Health Foundation, which has resources, 90 plus resources actually, on different sleep disorders and how you can manage your sleep. So whether your sleep is disturbed because of the pandemic, whether you have obstructive sleep apnea and want to start off with some resources, whether you have insomnia, whether you have anxiety and that doesn't let you sleep properly. So they have quite a few resources that you can get started on. But we do have sleep clinics for people who are experiencing insomnia or obstructive sleep apnea. So I can talk about Melbourne. We have sleep clinics at almost every major hospital where you can go and get tested for obstructive sleep apnea. And if you have insomnia, there are a number of sleep psychologists that are available. So you can specifically go to a psychologist that specializes in sleep and treatment of insomnia and consult them if you have sleep conditions.
So interesting. Okay. I'm going to now digress from sleep and talk about the recent Jean Hellis National Survey, of which you were a part of. And again, there was a very stark finding in that research, which said that migrant and women and women from CALD backgrounds did not have access to resources in terms of mental health. Now, can you tell us why is that so?
So, in some ways, I think Jean Hill's survey was such a recent snapshot of how women are experiencing or going through the pandemic and how we are sort of coming to that COVID normal. And I found it quite interesting that it pointed out that more than 55% of culturally and linguistically diverse women felt that their mental health has worsened. There were quite a lot of women from CALD communities that stated that they have difficulties affording healthcare or not knowing what sort of support they can look for. And I think it's quite multifactorial in the sense that it's not one reason or the other in terms of why women can't, from migrant communities in particular, why they can't seek support. So from the survey itself, we know that there are factors like not having enough resources to access support. So healthcare might not be affordable to you. But also factors like you may not actually know how to access that support. So you may want it, but you might not know what are the steps that I can take. And this is where Jean Hales has been working quite extensively to create resources for people to go onto their website and explore. So if you're a woman and you're confused about what's the first step that I can take towards my mental or physical health, or how I can approach it, their resources could be a good place to start. They're written in different languages. They're written in simple English, so you can actually explore that first and then figure out the path for you. The other factor would also be that sometimes as women, I think we don't necessarily take care of ourselves. So within the pandemic, there were so many responsibilities, like you had to work from home, you had to take care of your family. You were probably a carer for children's or adult. And that also played a huge part in why women couldn't seek healthcare when they needed.
Now, when you say resources that these women can go to, which means they have to go online and find the tools to sort of, fill up the forms and all of that. Is that what you say?
So it's usually almost like a psychoeducation sort of resource. So if you are someone who um, isn't sure about what kind of help you need, you can go online to Jean Hale's website and then look for resources. So, for instance, their latest resources on anxiety and how you can. So, it talks about how you can recognize whether or not you have symptoms of anxiety, or if you do experience anxiety, what are the places you can look for support? Like, could you talk to people? You can seek support from your GP, you can seek support from a psychologist. But then it also has tools for healthcare providers so that they can understand how they can support communities that might not have enough resources, or called or migrant communities, how you can support them. So it's quite it's almost a diverse tool in the sense that it targets many different areas.
Yes, okay. Oh, fantastic. And those links are there on the Jean Hale's website.
Yes. So the website is www.jeanhales.org.au.
All right. Fantastic. It's interesting how the pandemic has really focused on mental health. Any closing thoughts? What are some of the things that you can, sort of advise? Yeah.
No, that's a very good question. I feel like one of the things that has come out of the pandemic is potentially our focus on mental health. Like, we've openly started to talk about it instead of just, instead of almost stigmatizing mental health, especially in migrant and called communities where people might have this thought about like, oh, I don't want to talk about my mental health, or that's not really a thing, or we don't see it in the same way as we see physical health. But in that sense, I think the pandemic has really brought mental health into focus, and especially migrant and called communities have started talking about it. If I could give a few strategies or recommendations based on the research that we've been doing and what we've found, I think one of the first few things to think about when you talk about your mental health is to see it in the same way as you see your physical health. So just like for your physical health, you need to exercise, have a good diet, you need to sleep well, the same way you need to take care of your mental health through exercise, diet, and sleep. One of the factors that I think is universal but also specific to called and migrant communities is social isolation. So you might be in a different country where you may not have your friends or your family or people you care about close to you. So it is a good idea to reach out to these people, whether it's in terms of sort of having friends or catching up with people, or it could even be simple things like doing a Zoom call with your family members or people who might not be staying with you. So that in that sense, I think that's a difference that pandemic has made as well, that even our family and friends who weren't used to using video conferencing tools now do that. So yeah, reach out for yourself, but also if you notice that your mood is changing, or if you feel that you feel sadder than usual, if your activities have changed, if you feel like you are stressing more than usual, it's a good idea to reach out to at least to your GP, who can then provide you support. So GPs can get you in touch with psychologists where you can confidentially discuss your issues as well. So I would say take care of your mental health just like you would take care of your physical health. Reach out. So don't be socially isolated. Talk to people that you care about, who are your friends. And of course, if you feel like you need help, reach out to your GP as well.
Thank you so much, Prerna. That was so informative. Really lovely to have you.
Thank you so much, Indra. Really lovely to be here as well.